The recent increase in COVID cases in children is leading some parents to bypass vaccine requirements so kids younger than 12 can get the shot. The FDA recently warned parents not to do this, but the agency may be getting closer to authorizing the shot for younger kids. Pfizer announced this week that its COVID vaccine is safe and highly effective in children ages 5 to 11 years old. CBS News chief medical correspondent Dr. Jon LaPook spoke with one parent who does not want to wait.
It was probably the scariest thing as a parent I've had to deal with.
Lisa Shapiro says she felt helpless watching her daughter suffer from COVID.
Is it going to turn on a dime? And is, shortness of breath walking up the stairs going to turn into serious shortness of breath where she can't catch her breath?
While both girls are okay now, Shapiro knew she did not want them to go through it again. She got her 14-year-old daughter, Ann Payton, vaccinated this summer. But her younger daughter, Alexandra, is only 11.
We're very itching to get it. We're impatiently waiting.
Have you been tempted to ask your pediatrician, come on, she's 11 and a half, that's almost 12?
I have been absolutely tempted.
I know of some families who have very large 11-year-olds who have sort of snuck into some of the mass vaccine sites and things like that.
Dr. Scott Krugman is vice chair of pediatrics at the Herman and Walter Samuelson Children's Hospital at Sinai in Baltimore.
When a parent asks you to vaccinate their kid who's under 12, what do you say to them?
It's really important to wait for the tests to be done, the studies to be done, and the Advisory Council on Immunization Practices and the American Academy of Pediatrics to say, now's the time. And we're hoping now's the time is coming sooner rather than later.
Parents are also hoping authorization comes soon, especially since Pfizer said its vaccine is safe and effective in young children.
What do you think about the news coming out of Pfizer about their vaccine for 5 to 11-year-olds?
I'm thrilled. I'm excited. I've been waiting for it and hoping for it. Having the vaccine is everything. It will take so much worry away.
Dr. Jon LaPook is joining us right now. Good morning.
Morning.
Now, should the authorization process make parents a little bit more optimistic?
I think it should. You know, Nate, the FDA can't win, right? Some people say they're moving too quickly. Other people are saying they're moving too slowly. Remember, 5 days ago, there was an advisory meeting of the FDA to consider whether the booster should be given, the Pfizer booster should be given for people 16 and over. And you remember the president got a little bit ahead of this and had raised expectations that on the 20th of September that people 16 and above would be eligible.
So when it didn't happen, people were frustrated.
Right. I mean, but he did say it has to be CDC and FDA approved. And sure enough, during the advisory, I sat through 8 hours of them discussing, really smart people, and they said, you know what? The data's not there yet. We're going to say it's okay for a different group, but we'll see. We may change our recommendation as more information becomes. I think people should find that reassuring. There are checks and balances.
What are the dangers, potential dangers? What's the big deal, basically, if you give a kid, 11-year-old, say, an adult dose of the vaccine?
Well, we're always taught in medical school that kids are not just little grown-ups. So there are changes in hormones. Kids are going through puberty, and they're very careful about the kind of doses they give. You give too much, you could get too much of an inflammatory response. You could get pain at the site, fever, headaches, joint pains, even some rare inflammatory reactions. I spoke to Pfizer yesterday, and I talked about the dose. Remember, 30 micrograms of the Pfizer dose vaccines given in adults. They tried the 10, 20, and 30. They found, you know what, 10, the lower dose, gave just a really good response. So you always in medicine want to give the lowest amount of a medicine that still gets the response.
Well, you mentioned that you talked to Pfizer yesterday because now they're saying it's okay for kids 5 to 11. How soon can we get it then?
Well, it's another example of the regulatory process that should reassure people. So even though Pfizer just came out this week and said it's safe and effective, the FDA says, fine, we want to see the data, and we think that they're going to get that. Pfizer tells me they're going to get that to the FDA by the end of this month. And then they're going to not believe what Pfizer said. They're going to go through their records, and they're going to do their own statistics. It may take about another month. So I'm hearing maybe around Halloween.
Does the spike in COVID cases in children dispel the narrative that kids, they can't get it?
Yeah.
Absolutely, kids can get it. About 1 in 4 of the new cases are in kids. You know, we see 28 million kids in this new age group, 5 to 11. So there's a real opportunity to vaccinate this group. We're seeing a rise in hospitalization. We've done a lot of stories about
But
this.
for so long, we were told you don't really have to worry about kids.
And parents still lean on that.
Yeah, they do.
I think that's a false narrative. The general idea is that the kids tend to get less severe illness, but they can still get really sick and die. And remember now, as more and more grown-ups get vaccinated, then it's going to tend to gravitate down to lower groups that are not vaccinated.
So what's your advice on how you can keep your children safe until they get the vaccine?
All right, so it's multiple layers of protection.
Okay.
So everybody's got to get vaccinated who can possibly get vaccinated. Thinking about a school, right? Everybody should be wearing a mask who can wear a mask. Testing. Not enough testing's being done. Dr. Rochelle Walensky is the head of the CDC, was talking with me a couple of weeks ago and said, you know, there are billions of dollars that have been allocated for testing for schools, but the schools aren't asking for it. And finally, and super important, is ventilation and filtration. We've been talking about this, trying to hammer this. The aerosol scientists are jumping up and down saying it's really important. It travels through the air. Think about cigarette smoke. It's not just 6 feet or 3 feet. If you were smoking a cigarette and we're indoors and it's not well ventilated, am I going to smell it?
Yes.
Well, then potentially you can do that. So MERV 13 filters, HEPA filters, open the doors, crack the windows. But I think parents out there should talk to their school boards and the local authorities and say, what are you doing? What's the plan for ventilation and filtration?
And if the school isn't testing, parents, you can test yourself as well.
Yeah.
Thank you so much, John. We appreciate you.